Hello there, ladies and gentlemen. This is Rick McDermott here with Senior Solutions Group, and thank you for checking out this video. I've been a member of NABIP, the National Association of Benefits and Insurance Professionals, for the last several years. NABIP, formerly known as NAHU, represents over 100,000 health insurance agents, brokers, consultants, general agents, and benefits specialists from across the country. And in NABIP, we are committed to ensuring affordable, equitable health insurance options for all Americans. And we play a vital role in all of our communities we represent. We simplify health plan selection for our members. We provide local, friendly, expert assistance year-round to individuals, families, seniors, and employers. We help our clients understand their coverage and help them maximize their benefits effectively. We were in DC. We had about 740 people there gathered next to the Capitol, and there were 220 first-timers. This was my second trip, and we basically were there to make our collective voices heard on Capitol Hill. So we come from all political persuasions, from left, middle of the road, center right, right. So we want to put our political differences aside and stand up for people that need help with health insurance, whether they're on Medicare, individual plans, or employer-based plans. And my focus is on the Medicare side of things. Our main objective was, one, to make COBRA credible coverage once and for all. People who leave an employer for whatever reason due to health, for example, if you have a health condition and you really want to stay on your employer-based health plan, now you have to pay the premium since you resign your position at your employer. Why should that now not be considered a credible plan just because you are now paying the premium instead of the employer? So once and for all, COBRA needs to be called credible coverage for the purposes of Medicare, not paying late enrollment penalties if you go from COBRA to Medicare Part B, past age 65. The other thing we want to get placed is a extended open enrollment window for people who are on Medicare standalone Part D prescription drug plans. So people that are on Medicare Advantage, which is the private alternative for people with Medicare, private health insurance for people on Medicare, those people have an extra 3 months to make one final plan change. So everyone has the October 15th through December 7th annual election period. People on Medicare Advantage have an extra 3 months, January, February, March. Why do the people that are on standalone drug plans only have until December 7th? For example, if you go to your pharmacy in January, February, or March, and the prescription drug that you were on the previous year that was covered is no longer covered, you have no recourse other than to go on a different drug that may not be as effective. Well, what if you had those 3 months to change your drug plan? Because these plans can change from 1 year to the next. 1 year they can cover your drug and then the next year not cover that drug. Or 1 year your pharmacy may be in network and the following year your pharmacy may be out of network. Or with the premium stabilization program, we don't know what the plan premium could be from 1 year to the next. And if you don't read your annual notice of change letter, or if you forget about it, which a lot of people do, when the rubber meets the road, when you go to use your plan, why not have that same right that people on Medicare Advantage have? So we are fighting for your right to have an extended 3 months to change your prescription drug plan, just like people on Medicare Advantage do. Have you ever been to your doctor and noticed that you pay an extra surcharge because that doctor clinic is now owned by the local hospital or by a hospital network in your region? Why should you have to pay an extra hospital surcharge for the same service that someone that doesn't go to a clinic that is owned by a hospital? Why do they pay less and you pay more, sometimes double the price for that same exact service? We are trying to get that law changed where hospitals can't buy doctor clinics and charge you an extra fee just because they own that clinic and is now an extension of the hospital. So we want to codify that as part of the law. We also want to codify telehealth. During the COVID pandemic, telehealth became much more essential, and they've have some benefits for telehealth for Medicare. We want to codify that so it's more convenient. I've used telehealth. It's very convenient. If you have strep throat or if you have a flu symptom, you can go on your phone or on your device and talk to a doctor without having to get in the car and go to the clinic. So we want that to be part of Medicare forever and ever, amen, as well. So the other thing we want to talk to you about is insurance companies pulling the rug out from underneath agents who are fighting on your behalf. 3 out of 4 people on Medicare rely on agents to help them with their plan selection. Well, some of these plans this fall decided to no longer compensate agents for their services, which often what that does is it directs people to call centers. Maybe you can call 1-800-Medicare or call the insurance company directly, where the insurance company may not have your best interest at heart. They are biased. They want you to sign up for their plan, often the most expensive plan, which may not be in your best interest. So we want that to change. The insurance companies can't, and they shouldn't, change the rules midstream, the middle open enrollment period, where our hands are tied when that happens. Obviously, we have to keep the lights on, but more importantly, we want to be a resource for you to get the most non-biased information that can effectively help you navigate the labyrinth, the maze of Medicare and health insurance. So if you have any questions and you want to reach out to your representative, please do so. Your voices need to be heard. We made our voices heard. We are continuing to make our voices heard. We heard from over 10,000 people across the country who've relied on us, your agents, to help you navigate the Medicare maze. We sent that list off to our representatives and to the representatives at CMS Medicare. We have made our voices heard. We are not going to stop. We are here for you if you have any questions. And by the way, if you haven't subscribed, please subscribe to our channel and share this with a friend. Take care and have a great rest of your day.